Defence Forces medical teams will be deployed to the Eastern Cape as COVID-19 cases overrun that province's healthcare facilities. The province has recorded 27,686 infections and 422 deaths. Meanwhile, 16 pupils who tested positive have fled a quarantine site. At least 204 pupils and teachers have tested positive. For more on this, we are joined now by the department's, the HOD of the Health Department in the Eastern Cape, Dr. Thobile Mbengashe. Mr. Mbengashe, thanks for your time. Firstly, let's start with the SANDF who are being deployed to your province. Are health facilities feeling the strain right now? Or perhaps a better phrase would be, are things falling apart?
No, the health facilities are feeling the strain right now. I think it's absolutely welcome that we will have additional support to come into. What has really tested our system is that we got a duality of problems. One, we had not anticipated the number of infections that will be amongst our health workers and the number of health workers that would be out of work. And that has created a much more earlier agencies in the capacities of the healthcare system. So additional health care workers from the South African Defence Force will make a major contribution in making sure that we're able to contain and continue providing high-level care at the levels of the surge of the new patients that are coming to our hospitals.
What about the Cuban doctors? Are they any, force to be reckoned with?
Yes, they actually have helped us very well, because remember, what we were trying to do was to deal with an epidemic and trying to really refocus about how best to actually contain the infection. So the Cuban Brigade worked with our teams in the field to try and understand how best to respond in the hotspots, and they are really doing a sterling job.
Dr. Mbengashe, the death rate in the Eastern Cape is quite concerning at this time, in fact, extremely worrying. 25 people died yesterday, according to the stats that are released by the health minister on a daily. How many of those deaths in the Eastern Cape were between the ages 0 to 20 years old?
Actually, less than 5%. What we're finding that when we're actually monitoring this, especially because we knew right up front that the most vulnerable are elderly with people with comorbidities. So the younger people are doing very well. It's the older people who have comorbidities that are doing poorly. So the people who have actually died are more like those ones that have been advanced age, a lot of comorbidities, hypertension and diabetes and other conditions.
Dr. Mbengashe, how far are you in tracing the 16 pupils who fled the Makaula quarantine site? Because one of them now, as reports go, in fact, as we were told by the MEC of Education in that province, he's now infected 12 other people. Tell us a bit about that story.
Well, look, I think the most important things about the story is that we are now facing the kind of more critical stages where younger people are getting infected and we need more spaces to keep them up and actually isolate them. I don't have the details about the 12 young people, about the ones who have infected others. But really the key message is that anyone who's infected must stay in isolation, must protect other people, and it's something that the community now must take up and actually assist the healthcare services and education systems to do that.
What about the call from the Education MEC for schools to shut down because of not just the infection rates, but the number of people who are dying? Do you agree with him?
I think we have seen the effectiveness of the lockdown in terms of flattening the curve. And I think in many of the lessons learned in other countries is that when you have a high level of triggers, and those triggers are policy decisions about how much levels can you really sustain the high levels of increase, then you get what is called serial lockdown. So that is an option that the government has, and it will exercise it when it really feels that this is really the time. I think some of the worrying aspects in the Eastern Cape are starting to push us to think very hard about what would be the implications of a lockdown in the province.
Dr. Mbengashe, I'm running out of time. I'm going to repeat that question. Do you agree with him that schools should be shut down?
Look, it's a policy decision. I think what we need to do is to strengthen all in aspect of really reduction of the transmission. The key issue is really to make sure that we've got the social distance, we're wearing the mask, and we're doing all the protocols. And I think that decision will be done at a national level. And we think that we're slowly moving in a very high levels where the levels of infections will not be sustainable. They can create huge problems in our healthcare system. And I think that matters would be considered at all times. Yeah.
On the dumped test kits, have you taken any action against the courier company?
The key issue there is the matter that the National Laboratory Services is actually dealing with it. And I think it's in the ambit of the national. I've spoken to the CEO and I've spoken to the local teams that are taking it very seriously. What we feel is important for us is that we cannot have a situation where people doubt the services that we're providing, especially testing. Testing is the #1 strategy.
Well, that doubt, Dr. Mbengashe, that doubt, I'm sorry to cut in, that doubt has now already been planted in people's minds. Just seeing those test kits lying on the side of the road was simply not acceptable. Have you laid charges against this company as per the call of the health minister?
Yes, it's the national laboratories that will do that job, but we support laying charges on anyone. And it's not the Department of Health in the Eastern Cape, it's the national laboratories that's responsible for the test. But we support that call. It is totally responsible, and we apologize to the people of the Eastern Cape. It should have never happened. It shouldn't happen again.
Dr. Mbengashe, final question to you. Healthcare workers are being infected in their numbers in that province. The system itself, I know we started with this question, but it absolutely is worrying. Hospitals are overwhelmed. How bad is the situation?
No, actually, we had really what is called a stress test at Dora Nginza, where we had some of our maternity units were not working. And this was an extreme aspect of what was unexpected. Healthcare workers are being infected. We've got about 5% of the total number of people infected as being health workers. It's a worrying thing, and we're really relooking into all our protocols to make sure. We think that one of the biggest problems is really not the PPE itself, it's the other gathering aspects, like the tea rooms and all those kind of, and the health workers having to really take these extraordinary precautions outside the hospital. So we have made our hospitals now what is called universal mask areas, because we think that every person must wear a mask to protect the next person.
Dr. Thobile Mbengashe is the Health Department's head of department there in the Eastern Cape. Thank you very much for your time.